Welcome to Understanding Cancer. Today we're visiting with Dr. Bendell from the Sarah Cannon Research Institute in Nashville, Tennessee. Welcome to the show.
Thank you so much.
In other diseases, we're starting to see tests being done on the actual tumor that's been removed to help select these therapies. Is there anything being done in colon cancer?
So we are starting to get some evidence with patients with colon cancer about looking at specific aspects of their tumor to decide if you should or should not get chemotherapy. There's been some suggestion for patients who have what we call stage 2 colon cancer, where it has not yet spread to the lymph nodes, that they have a certain tumor marker, as we call it. It's called microsatellite instability, and we can test that on the surgical specimen. If they do have microsatellite instability, there is a suggestion that patients may not benefit from receiving chemotherapy, and in fact may even do worse if they do receive chemotherapy. So we are starting to understand that there's some patients that will do better without chemotherapy. We are testing this in a clinical trial that's currently ongoing in the United States, which is available nationwide, this clinical trial. And it's actually taking patients and looking at some of these biologic components and assigning patients to specific treatments based on those components. And that hopefully will give us even more information about how we should treat people.
Now, is that test being routinely performed today?
In general, yes. The microsatellite instability is generally done by the pathologists who are looking at the colon cancer specimen and should give the report to the oncologist and the surgeon about whether or not there is microsatellite instability.
And if for some reason you were treated in a place where that test wasn't performed, and then the patient is referred to a medical oncologist, can they go back and get the results of that test?
Absolutely. What the medical oncologist can do is have the pathologist run that test. It should be covered by insurance, and it should be it's something that the pathologist can go back and do afterwards.
So if you're an early stage patient, you would want to have that discussion with your oncologist?
Yes, I do believe that it's important to say, is there some specific marker to my tumor that can help guide whether or not I should be receiving therapy and what therapy I should receive?
Well, it sounds like very good advice, and I really want to thank you for joining us today.
Thank you.
And I do hope you'll come back and visit with us again sometime.
Thank you so much.